Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. My name is Ahmad Qamarul bin Mustafa Kamal. Matrix number 2023168485. So today I will present about my defense research proposal, and my topic is the effect of hamstrings cooling and cry stretching on hamstring flexibility among healthy young adults. So this is the table of content. Firstly, background of the study. Introduction: flexibility is essential for optimizing athletic performance and minimizing injury risk. Techniques such as cryotherapy and cryo-stretching are often used to improve hamstring flexibility. Cryotherapy, when combined with stretching, has been shown to enhance flexibility in some cases due to its impact on reducing muscle stiffness and stretch discomfort. Other studies have noted variability in outcomes depending on intervention, duration, and methods that being used. The problem statement is limited flexibility may lead to injury and decreased athletic performance. Second point is previous studies shows conflicting results on the effectiveness of cooling and stretching techniques. The purpose of the study is to evaluate the effect of hamstring cooling and cryo stretching on flexibility of athletes, measured using the sit and reach test. Other than that, it explore the immediate effect of this intervention on flexibility performance by using hamstring cooling and cryo stretching method. Last point is the purpose of the study is to help healthy young adults enhance their flexibility quickly before or after physical activity. So the objective is to assess the immediate changes improvement in hamstring flexibility after applying hamstring cooling. The second objective is to compare between cryo stretching, cooling and static stretching as a greater effect on flexibility than cooling alone. So there are three research hypotheses, which is the first one is there is no significant difference in hamstring flexibility after hamstring cooling. The second one is there is no significant difference in hamstring flexibility after cryo stretching. And last one is there is no significant difference in hamstring flexibility after hamstring cooling and cryo stretching. So limitation and the limitations, we go with limitation first. The first one is the effort by the participant during test. The second one is undisciplined participant for time management. And for the limitation is hamstring cooling for 15 minutes, cryo stretching until numb, and at 30 seconds of stretching for each leg. Significance of study help in understanding whether hamstring cooling or combined with cryo stretching improve flexibility in athletes. This can guide sports trainers in choosing effective methods for flexibility enhancement. So this is the literature review that I came out. There are 10 of them. So this is 5 and this one is 5. So from all of the 10 journal, I came out with the summarization. So for the first point for summarization is stretching with cryotherapy. Effective for short-term flexibility, especially as pre-activity intervention. Reduce discomfort and enhance range of motion, ROM. Second point is PNF stretching. Superior to static stretching for improved flexibility, especially in younger athletes. The third point is sit and reach test, a valid general tool for assessing hamstring flexibility but limited in isolating hamstring from other muscle groups. The last point is combination findings. Ice assisted stretching is more effective than heat or no stretching, but combining cryotherapy with PNF does not provide significant added benefits. So for conceptual framework is the independent variable is intervention type, which is cooling, cryo stretching, and control. For dependent variable is sit and reach test performance, flexibility, and the population is 30 healthy young adults. For the research methodology, first one is research design. The design is through experimental pre-test post-test design, population sampling and sample size calculation, population 30 healthy young adults, sampling method, convenience sampling and purposive sampling selecting from healthy young adults. The third point is inclusion and exclusion criteria. Inclusion, IPAC question, healthy young adults, and does not have any injuries for the past 3 months. For the exclusion, athletes with current injuries, any diagnosed condition related to the nervous system or balance impairment, and last one is disrupted attendance throughout the intervention period. So, for the G power, the effect size that I found from my journal is 0.77, and the sample size from the G power is 24 participants. So the research instrument that been used in this research is crossover randomized clinical trial, which is RCT. So firstly, the equipment is seat and reach test box, ice pack, stopwatch, massage bed, and data form. So the method from instrument, participants sit with legs fully extended, feet flat against the seat and reach box, hands are placed on top of each other's, and participants reach forward as far as possible. Ensure knees remain fully extended during the test. Record the furthest reach in centimeters. And last one is conduct 3 trials and use the highest score for analysis. So the data collection procedures, first one is athletical approval. Second one is screening, which is IPAC questionnaire. The third one is pre-test. All participants perform the sit and reach test as baseline measure. The fourth, for the number four is random assignment. All of the 30 participants will have to do all of the intervention group. The group is hamstring cooling group, cry stretching group, and control group. So for the intervention group one, which is hamstring cooling, apply ice pack to the hamstring for 15 minutes. The second group is cry stretching. Apply ice pack to the hamstring for 20 minutes until numb, and then perform PNS stretching for 30 seconds on each leg. And for the third group, which is control, rest for 15 minutes without intervention. So for the post test, all of the participants perform the sit and reach test again to measure flexibility changes. Rest 1 day minimum for each intervention groups. And the last point, which is for the last step, is data analysis. So this is the Gantt chart. For proposal writing, will start during October until December. This different research proposal will start on December. Ethic approval will start during January. The data collection will start from March until to April. Data analysis will be done by May, and full writing will continue from May to June, and submission will be on July 2025. So this is all of the 10 references for my journal. So that is all from me. Thank you. Assalamualaikum warahmatullahi wabarakatuh.